I will now review the different ways in which the excimer laser is used to correct your vision. There are two locations on the cornea that these laser treatments can be delivered to achieve their effect: on the surface or under a flap. Each treatment is based on many factors along with that individual patient's prescription. The higher the prescription, the greater the amount of sculpting and the longer the visual recovery time. Based on your history and the eye measurements obtained, we will be able to recommend to you whether reshaping the cornea on the surface or under a flap would be the best option for you. The original procedures approved by the FDA were performed on the surface of the eye and were called PRK, or photorefractive keratectomy. During PRK, the surface layer or epithelium is removed prior to treating with the laser. Several new variants of PRK, known as epi-LASIK or LASIK, differ only in their attempts to preserve the epithelium that is reflected back before the treatment. The laser treatment is then delivered to the corneal surface and the epithelium is repositioned at the end. For the purpose of this video, we will refer to all of these surface treatment variants as advanced surface ablations, or ASAs. In the early 90s, surgeons in Europe combined the accuracy of excimer laser sculpting with the comfort and rapid rehabilitation of a flap-creating procedure that originated in Colombia in the early 60s. When the laser is used to remove corneal tissue from its inner aspect after creating a flap, the procedure is called LASIK, or laser-assisted in situ keratomileusis. LASIK literally means to shape the cornea within using a laser. In this procedure, there are two steps. In the first step, the eye surgeon creates a flap of corneal tissue approximately 1/3 of its overall thickness. This flap of tissue, which remains attached by a hinge, is then folded back. In the second step of LASIK, the excimer's cool light beam is used to gently remove the underlying tissue. Following the treatment, the flap is laid back and heals in place without the need for stitches. To illustrate the difference between ASAs and LASIK, consider the analogy of a 400-page book with 50-page thick front and back covers. In ASAs, the cover of the book is first removed or folded back, the front pages of the book are in turn removed, and the cover is allowed to grow back. With LASIK, the cover and the first 100 or so pages are folded back on the binding, the middle pages of the book are removed, and the cover and front pages are put back in place. Both ASAs and LASIK can treat nearsightedness, farsightedness, and astigmatism, and both ultimately achieve the same excellent results. However, by the late 90s, LASIK had gained in popularity over ASAs and became preferred by most, when possible, because of its rapid rehabilitation of vision, measured in hours rather than days, and its greater degree of postoperative comfort. In addition, if laser retreatment is required, the flap can be gently lifted, whereas with ASAs, the entire procedure needs to be repeated. LASIK, however, does involve an additional step, the creation of the flap. Until recently, this step could only be accomplished with a mechanical device called a microkeratome. Now, an amazing new laser technology called Intralase has become available that makes the first step of flap creation even safer and more precise than ever before. Intralase uses femtosecond technology, which was originally developed by Harvard physicists in the early 70s and later earned the Nobel Prize for Chemistry in 1999. A femtosecond is 1/400th of a second. To give you an idea of how short a femtosecond is, there are the same number of femtoseconds in 1 second as there are minutes in the age of the universe, some 12 billion years. During the Intralase procedure, 15,000 pulses per second are precisely delivered at a specific depth in the cornea. Each of these pulses creates a microbubble with a byproduct of carbon dioxide and water. When close to 1 million of these bubbles are connected, a flap of incredibly precise, uniform thickness is created. There are some situations in which Intralase is clearly beneficial to patients looking into LASIK. In those who have been diagnosed with dry eye, Intralase spares some of the sensory nerves in the cornea responsible for reflex tearing than the manual keratome. Intralase also places less pressure on your eye than the microkeratome. Aside from comfort considerations, this creates greater safety for patients who are glaucoma suspects. Intralase can also allow some of those who were not previously considered candidates due to thinner corneas the ability to have the procedure. This is because Intralase is more accurate and hence flaps can be made thinner. Finally, although LASIK has been performed safely for years, many potential candidates have been resistant due to fear of the mechanical creation of this corneal flap. If fear has been a major obstacle to your pursuit of laser vision correction, Intralase should provide you the peace of mind needed to move forward with this procedure.
I've been wanting to do LASIK for approximately 5 years. I always had a fear of the cutting of the eye being done manually, and once I found out that they had the intralaser, that was all the laser technology to create the flap, it made me more at ease and put me at a comfort level with doing the whole procedure.
Coming to do the procedure, I was scared, terrified. Once doing the procedure, once it started, everything was awesome. It was nothing like what I expected. Coming out of the procedure, 15 minutes afterwards, I was seeing 20/20. Went home that night, slept, had no problems with my eyes at all. Woke up the next morning, came back for the post-op, and I was seeing 20/15 just the very next morning. And my eyesight now is, a few days later, is better than I've ever seen with glasses or contacts. And not having to rely on those for the rest of my life is invaluable.